Hi viewers, this is Dee, and I'm here to present to you guys our evidence-based practice group presentation titled Pet Therapy in Elderly Patients. So why did we choose this topic? In the beginning, it was very hard for us to come up with the topic. It seemed like it took forever for us to pick one. But after thinking for a while, the effects of pet therapy on quality of life, particularly in the elderly population, is what turned on the light bulbs in our heads. It is thought to be natural for our health to decline as we age through life, and knowing this made us realize how important it is to shed light onto this topic. Since declining health is looked at as normal, the health of elderly patients is commonly looked over. The elderly population suffers from declining health both physically and mentally, so it is beneficial to find ways to help elder adults cope. Another important aspect of this study is that pet therapy has actually been proven to be effective in increasing the quality of life in elderly adults. So now let's talk about our scope. In our study, we only investigated the effects of pet therapy on the quality of life in elderly patients who were at or older the age of 55. We did not include elderly patients under the age of 55. We did not set any limitations on the setting of where the participant was located. Moving right along to our PICO question. The purpose of a PICO question is to stand as a systematic way to identify important concepts to include when formulating a clinical question. The PICO question that we formulated is, in elderly patients age 55 and older, does pet or animal therapy positively influence their quality of life? So let's break it down. The P stands for the patient or problem, and here we have elderly patients age 55 or older. I, or the intervention, is pet therapy. For C, the comparison was having no alternative therapy at all. The outcome is to improve quality of life, and we did not have.
A literature search is a systematic and explicit approach to the identification, retrieval, and bibliographic management of independent studies for the purpose of locating information on a topic, synthesizing conclusions, identifying areas for future studies, and developing guidelines for clinical practice. Our group utilized computer database searches as they are the most efficient way to identify published studies. The three databases that we used were PubMed, EBSCOhost, and ProQuest. First, we identified pet therapy as an intervention that we wanted to search. We conducted a preliminary search to identify content and volume related to pet therapy in the elderly population. Then, we limited our search to full-text, peer-reviewed articles that were published after 2011. We were only able to apply a limit of searching for an author on EBSCOhost. After limiting our guideline topic with our PICO question, defining the parameters of our literature search, all group members conducted a thorough search of the literature. A literature review is different from a literature search. A literature review involves analyzing, evaluating, and synthesizing scientific evidence derived from studies identified through the search process. After conducting our literature review, we utilized 4 studies from ProQuest, 2 from EBSCOhost, and 2 from PubMed.
So the first article that I chose is titled Pet Therapy as an Alternative Therapy for Residents 65 Years and Older in Long-Term Care Facilities to Decrease Signs and Symptoms of Depression, Blood Pressure, and Heart Rate. I know it's a mouthful, but it's actually a really good article. The study was done to determine if there is a difference in heart rate, blood pressure, and self-reported depressive symptoms with the use of pet therapy in long-term care facility residents age 65 and older. There were 3 questions that were developed that needed to be answered during the study. Those 3 questions were, is there a difference in heart rate before and after pet therapy? Is there a difference in blood pressure before and after pet therapy? And is there a difference in self-reported depressive symptoms before and after pet therapy? The design used was a cross-sectional, non-experimental pre-post design that was used to investigate those differences. The questions were broad in scope and nature to prevent any ethical or moral conflicts. The initial sample size for the study was 32, and 2 participants decided not to complete one part of the study, so they were left with 30 participants in the end. The setting was 2 long-term care facilities in Pennsylvania. After conducting the study, There was found to be a statistically significant relationship between pet therapy and heart rate, blood pressure, and self-reported depressive symptoms. Pet therapy was found to be a way to improve physical and psychological aspects of those participants. This is important in providing holistic. The second article that I chose is titled Pet Ownership in Older Women, the Relationships Among Loneliness, Pet Attachment Support, Human Social Support, and Depressed Mood. This study was done to investigate relationships between loneliness, pet attachment support, human social support, and depressed mood in older women. Women were eligible to participate if they met the following criteria. 1, being aged 55 to 84 years old. 2, owned a cat or dog. 3, resided in independent housing. And 4, were able to communicate in English. They asked the participants to indicate their age, race, marital status, educational history, living arrangements, and housing type. The instrument packet took about 20 minutes to complete. The final sample included 159 women whose ages ranged from 55 to 84 years old. A convenient sample was done on site at sites that were either independent, pet-friendly housing communities for seniors, or senior citizen community centers located on the East Coast of the U.S. The results of this study showed that pet attachment support stood as a coping mechanism between loneliness and depressed mood. Pet attachment support influenced the relationship between loneliness and depressed mood, indicating the importance of pet attachment as a greater form of support in this.
Hi, my name is Asia, and I'm here to talk about my 2 articles that I found that most identified with our PICO research question. So I started off looking for research articles using the key terms like dog-assisted interventions, non-pharmacological interventions, elderly dementia and non-pharmacological interventions, and dog-assisted wellness care. So one of the articles that I found was about robotic pet therapy. This article talked about how research has shown over and over again that pet therapy, traditional pet therapy, has been shown to be effective in treating behavioral symptoms and psychological symptoms as well as other symptoms. And they wanted to see if robotic pet therapy would have the same effect, but without all of the negative aspects that come along with having a traditional pet, like walking or feeding or the cost of having a pet. So this research took place over 12 weeks. They used 5 dementia units and they used a randomized control experiment. The control group did receive an intervention, which was activity, just normal activity like aerobics or jogging or walking. There were 61 participants, 77% of them were female, and this took place over 12 weeks. So that what they did was use a robotic pet that gave feedback to researchers. The robotic pet was FDA approved and it picked up the O2 stat and the heart rate. Researchers also used valid screening, and they used scales and measurements to determine the depression symptoms before and after. So what it was that for 12 weeks, they got 1 or 2 sessions a week that lasted for 45 to 60 minutes. And they measured the outcomes after using the same screening tools. So what they found was that they saw a significant difference in stress and anxiety related to dementia, as well as a decrease in psychoactive medication. So this article basically concluded that robotic pet therapy is just as good as traditional pet therapy, but without all of the negative aspects of taking care of a traditional pet. Another article that I found was about dog-assisted intervention, whether it could completely eliminate the need for like medications, or whether it could be put together with pharmacy. So this one took place over 6 months. And they used 8 nursing homes in Sweden. The population was really small. It was only 33 participants and 20 in the intervention group and 13 in the control group. They had 10 sessions. They used screenings, like they used a CMAI, and they used the MDDS, which are also used by UCLA, so they've been proven to be valid. So they had a control group and an intervention group. The control group did not receive an intervention. Also, they used convenience sampling as well. So this wasn't an experimental design. But they saw no significant difference in the change in baseline immediately following up. But they saw a small change at the 6-month mark, but it wasn't significant. It was just a small decrease in non-aggressive dementia behaviors, and they saw like a small increase in verbal agitation. So the conclusion of this article was that maybe dog-assisted intervention has some small whatever effect, but further evaluation is needed. And that concludes the summary of my research articles. Thank you.
The first article I chose was a pilot study titled Developing Effective Animal-Assisted Intervention Programs Involving Dogs for Institutionalized Geriatric Patients. It was conducted to try and determine if dog-assisted interventions are an innovative tool to increase quality of life in a geriatric population. The study aimed to evaluate the effects of dogs in reducing the everyday apathetic state as well as depressive symptoms in an institutionalized population of geriatric patients. The sample consisted of 19 persons, male and female, with a mean age of 85. Interactions between the participants and dogs occurred either in a social situation, which were regularly scheduled socialization sessions for residents to interact with one another, or in a therapeutic context, which occurred during physical therapy sessions. The researchers derived a specific ethogram of elderly dog interactions at evaluating the effectiveness of therapy dogs in improving mood, catalyzing social interactions, and reducing their everyday apathetic state. Cortisol levels were measured in saliva, and depressive state was evaluated by patient self-report. Overall, the results showed a time-dependent increase in social behavior and spontaneous interactions with the dogs. Dog-mediated interactions led to an increase in cortisol levels despite their everyday apathetic state. The researchers concluded that the dog-mediated intervention programs appear to be promising tools to improve the social skills and enrich the daily activities of the institutionalized elderly population. The second article I chose is titled Evaluation of Pet-Assisted Living Intervention for Improving Functional Status in Assisted Living Residents with Mild to Moderate Cognitive Impairment. It was a pilot study utilizing 40 assisted living residents that sought to evaluate the effectiveness of pet-assisted living, or PAL, intervention to support physical, behavioral, and emotional function in assisted living residents with cognitive impairment. In older adults with cognitive impairment, decreased functional status and increased behavioral symptoms require relocation from assisted living to nursing homes. This study randomized pet-owning assisted living residents into 2 groups. 22 were placed into an interaction group, while 18 were placed into a reminiscing group. Cognitively impaired residents were randomized to 60 to 90-minute sessions of interacting with or reminiscing of their pets twice a week for 12 weeks. A monthly assessment of physical, behavioral, and emotional functions like the energy expenditure, activities of daily living, depression, apathy, and agitation. In linear mixed models, physical activity and depressive symptoms both improved with PAL. Evidence supports that the PAL program helps to preserve and enhance function of assisted living residents with cognitive impairment. Additional studies are required to further evaluate the duration and other predictors of effectiveness of the PAL intervention.
With the two articles I found, they both prove that pet therapy definitely does improve the quality of life. The first article I really liked was by a nurse named Susan. She did her dissertation in Texas, and she was focusing on increasing mobility in the elderly community because she noticed as we tend to age, we tend to lose our mobility. And a lot of elderly patients, they tend to stay in one position all day, and she wanted to prevent that. So she went to an assisted living facility and she implemented a walking program. And she had two groups. One was a control group, and they were to either walk alone or with friends or peers. And then the second group was the experimental group, and they walked with dogs. So that was their form of pet therapy. And there was no set time frame on how long or far they needed to walk. She just wanted them to walk daily. And she tracked each day how far they walked and if they actually stuck to the walking program. And her results were found to be clinically insignificant, and that was because she had some limitations, such as one of the main ones was that in the experimental group, one of her residents had arthritis. So they weren't able to continue to walk as far and as long as they wanted to with the dogs because of the arthritis. So that impacted her results. But she found overall, majority of the people in the experimental group, they did walk longer each day with the dogs, and they increased their social interactions with their peers as well. And they actually stuck to the walking program. So in the long run, their mobility was increased, and their walking distance increased as well. And in the second article I found was another dissertation by a nurse named Judith, and he primarily focused on loneliness in the elderly community because he noticed that as we tend to age, we go through a lot in life, and as you age, you lose a lot of things that you're able to do as you were when you were younger, such as driving, and that can be a big deal to a lot of people because you lose some of your independence, or a loss of a spouse, or worsening medical conditions. Like, all that impacts us personally. And he noticed that people tend to retract from society because of that, and they get lonely and they get depressed. So he wanted to find ways to prevent the loneliness and depression. So he recommended from his research that the elderly population engage in pet therapy, and that we try to encourage them to go to social outings, whether it's a concert or go to the mall or the movies, and get them to even do community volunteering just to keep them active and engaged. And that he found that does prevent their loneliness. It decreases their depressive states. And pet therapy was one of the big ones that he found as well that did that.
Hi, in this video I will be appraising the article, Pet Ownership and Older Women, the Relationship Among Loneliness, Pet Attachment Support, Human Social Support, and Depressed Mood. This article was deemed to be a level 4. It was level 4 because it was a non-experimental research design. They used random convenience sampling, not randomized, and they also looked at regression. We believe that this study was conducted well. They used a demographic questionnaire, so they looked at race, natural status, age, education, living arrangements, and also pet type, whether it was a feline or a canine. They use valid tools. They use the loneliness scale, the PGWB for depression, and the PAS for pet attachment. And these were shown to be effective and valid over time, so they were already in use. It also got approved by Rutgers University to do the study. Like again, I said, they did use convenient sampling. They had a really large population. The population was of 159 participants. They used one principal investigator. So the investigator, he explained the purpose of the study and how the participants would be involved in the study, and he also answered any questions that they had about the study. And he also gave out the packets to fill out the scales and assessment tools, and he collected them, and he stayed there the whole time he was there. So by them using one principal investigator, it eliminated some variability that could happen, like if it was being explained two different ways, or if one person conducted it one way than the other person did. But it also could lead to bias because he is only one person explaining and giving out the packets and talking to the participants. Also, the researchers used the power analysis to gather their sample size to make sure that it was large enough. They use a power analysis for regression analysis to ensure adequate sample size. And like I said, the sample included 159 women. The credibility was found that the intervention, they regressed, but the dog and cat was due to the fact of the intervention or pet therapy of having a dog or a cat, and not just by chance, because the p-values was of significance. We do believe that this does have clinical significance to elder white women who are 55 through 84, who are widowed and who have a cat or a dog, because 77% of the population was of white females, and majority of them were widowed. So this is who we believe that this research has clinical significance on. We do believe that this has relevance to our practice because as nursing students, we have a lot of engagement and a lot of involvement with elder patients, elder women who may have loneliness or may have depressed feelings, and we will be able to teach and share our knowledge about pet therapy and hopefully give them new knowledge to help them out. And that is all. Thank you.
Okay, so from our synthesis of evidence, we found that pet therapy did improve the quality of life in the elderly population. It reduced, the main thing we saw that it reduced medical symptoms by lowering their blood pressure, decreasing their heart rate, and it also reduced their anxiety levels. But not only did it help with like the medical aspect, but it did help with if they were having like any behavior or psychological problems, they saw improvement in those areas as well. And some articles even mention that pet therapy, it increased the elderly population exercise activities, because many elderly patients didn't realize that they were exercising when they were interacting with the dogs, whether it was walking the dog or playing fetch with the dog, or just overall interacting with the dog. It improved their mobility, it increased their stamina, and it also encouraged them to exercise, because exercising or moving isn't always fun, but if they're doing it with the dog or any other pets, it was found more engaging. So
they were able to exercise longer. And that helped also with other aspects of their medical conditions. But not only with exercising, pet therapy, it also helped with their social life. So it was found that the elderly interacted more, not only with the dogs, but with their peers while doing pet therapy. And they were found to be more happy. They were laughing more, talking more, and it decreased depressive states. So overall, pet therapy is more of a holistic treatment, I think, because it helps in pretty much every aspect of their life. If we were to actually implement our evidence-based practice project, our first step would be to find a dog agency here in Atlanta that already has dogs trained especially for pet therapy. Then our next step would be to find 4 different nursing home locations here in the Atlanta area. And out of those 4 nursing homes, 2 of them, we would not implement any pet therapy. That would be our control group. And then with the other 2 nursing facilities, we would actually implement the pet therapy there. And we would make sure that the facilities do have a pet policy that allows us to bring the dogs there. And we would screen those residents and make sure that they don't have any allergies to the dogs or any unknown allergies, just to make sure that there is no medical attention that we may have to give them from the pet therapy. And then for all the residents involved in the projects, we would do an informed consent. We would make sure that the residents know what's going on and the purpose of it. And if they're not able to sign the informed consent, then we would ask their legal guardian to, and we would explain everything to them as well, just to make sure there's no misunderstandings. And the residents from each facility, we would make sure that they have similar medical conditions so that our evidence will be accurate. And then the pet therapy will be done 3 days out of the week. It will be Monday, Wednesday, and Friday. And each session will be 60 minutes. And the residents there, they will be allowed to pet the dogs, play with them, walk the dog, feed the dog, just interact in any way that they feel is okay. And then for the dissemination part of the project, we would have 3 information sessions at each nursing home facility, and with the staff and the nurses, just to make sure that they know exactly what is going on, what we will be doing, what we won't be doing. And we'll present our evidence that we have already found on pet therapy and why we think it is appropriate for our geriatric patients. And also, that'll just be a good way for us to get to know the staff there that we will be working with. And if they have any comments, questions, or concerns, they'll be able to ask us right there. And also for the future project part, the evidence that we find based on our project, it will be able to be used with the geriatric patients in the future. So instead of doctors maybe prescribing medications, they will prescribe pet therapy, because the evidence that we find from our project and even from past research projects is sound evidence that it has improved the geriatric patients' overall life, their quality of life, and it has improved medical conditions as well. So doctors will be confident enough to initiate pet therapy in their patients' lives. And also, if other people wanted to implement our project or repeated, they will be able to, and they can do it over a longer period of times, or it can be repeated in different geographical regions of the world, just to see how pet therapy works with different cultures and see what their results are. So our project definitely will produce sound evidence, and hopefully it will be able to be used globally instead of being prescribed med therapy, prescribed pet therapy.
Hi, in this video I will be concluding our results. As a group, we all conclude that pet therapy has positive outcomes as it is related to elders who face dementia, depression, and loneliness. We also believe that there is further research to be done because we think that it may be some other correlation or another correlation that is affecting the positive outcomes. Like, does pet therapy lead to more activity in elders? Does pet therapy lead to more laughter? And is that the correlation why they have better outcomes and positive outcomes from the intervention? That has been our research project, and we thank you for joining us. Thank you.